I welcome all of you to IBMTV and to this show, which is Dr. Dhawan's Lifechat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The Lifechat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste. Namaste. Good morning, good afternoon, good evening, depending on wherever you are. And welcome to yet another session of Dr. Dhawan's Lifechat. Today we have a very, very interesting topic to talk about. This word is so beautiful, and all of us are born beautiful. Every creature is beautiful. Wherever you look on this earth, there is aesthetics, there's beauty in it. However, sometimes due to accident, injury, disease, or congenital deformities, the beauty gets, blemished or tarnished. Those are the times which it has a great impact on the person who is affected. A great impact on person's image, individual image, their morale, their confidence. What can be done to take care of those situations and those times? So we have three great experts to talk about all this. These are the top three plastic surgeons in New Delhi, which I have as guests on my show. Let me call them one by one. Dr. Rashmi Taneja.
Hello.
Welcome, Rashmi. How are you doing?
I'm good. How are you, Sanjay?
All good. Dr. Rashmi is the head of the Department of Plastic Surgery at Fortis Hospital, New Delhi. And she has more than 25 years of experience of working in this field of aesthetic surgery. Next, we have Dr. Sunil Choudhary.
Hi, Sanjay. Great
Hi,
to
Sunil.
be
Welcome to the show. And Dr. Sunil happens to be my colleague at Max. He is the Principal Director and Chief of Plastic Surgery at Max, again with more than 25 years of experience in his field. And he's, again, one of the top surgeons of Delhi, very great in his job. Third is Dr. Vasundhara Oberoi.
Thank you, Sanjay.
Hi, good evening, Sanjay.
Hi, Vasundhara. How are you doing? Welcome to the show.
Sunil. Thank you.
Dr. Vasundhara is working as senior consultant at Gangaram Hospital, New Delhi, again with more than 20 years of experience of working in this field. So, with these three eminent guests, let me just start with very, very basics. As I said in my introduction, that we are all beautiful and this word is beautiful, but sometimes this beauty gets tarnished by some reason or the other. So, Rashmi, let me start with you. What are the indications, reasons, or times when you need to intervene and make some changes to remove the blemishes or to enhance the beauty of the person?
So actually, Sanjay, I mean, it wouldn't be that you have. Of course, there are a lot of congenital anomalies or things that you are born with, which for some reason lead to some abnormality of development, like a cleft lip or a cleft palate, or they can be somebody's born without an ear, or there are other issues which require corrective surgery. So these are more in the form of reconstructive or correction of birth deformities. But people also do come for plastic surgeries to enhance their normal appearance. So it's not like there's something wrong with their appearance, they just want it to be better. On the face, when you look at it, especially in young people, it could be improving the appearance of their nose. The ears are too prominent, you want the ears to be less prominent. Little children sometimes get teased about their ears being prominent. So, I mean, there's a whole host of things that people may want to correct. And of course, as we get older, everybody wants to turn back the clock. Nobody wants to look their age. Everybody wants to look younger, more youthful. So, as plastic surgeons, you're being approached to, turn back the clock for someone. But at different ages, there are different indications, there are different concerns that people may have for which they would approach a plastic surgeon.
This age factor which you said, that is the secret why I've called three of you today. I want to make friends with you so that when my time comes, I can reach out to you guys to reverse my age. Well, of course, jokes apart. Jokes apart, but Sunil, like Rashmi said, that sometimes people are not happy with their appearance as it is. There's no blemish, there's no scar, there's no deformity, but they're still not happy. How do you deal with those people, and when do you decide to actually make changes in those people who are otherwise normal, but they're not happy with their appearance or something in their body?
So, if you really understand the definition of being healthy, it is not just the absence of physical ailment. It is also about emotional well-being, psychological well-being. So, consciousness of appearance because of any disproportion in the body, face, any parts can really have a very bad impact on their self-esteem, on their self-confidence, and that is one of the prime indications for doing something about it. Obviously, one has to rule out a mental instability. People should not be worried about something which is extremely minor. People should not think that everything revolves around that, and people should not have unrealistic expectations. And we should always kind of, be, very careful about not operating on people who are actually not stable mentally, and they may be actually suffering from what we call a body dysmorphic syndrome, where they may keep on, having multiple surgeries and still not actually be happy about it. But overall, majority of our patients, I would say more than 80 to 90% of our patients are actually normal patients who are just suffering from consciousness of appearance. And it is all about how you feel about yourself. When you look at yourself in the mirror, you don't actually, the image that you see of yourself doesn't fit into the image that you have of yourself inside. You might actually feel very young from inside, very energetic, but when you look at yourself in the mirror, you may not like the lines that you have on your face or anything like that. Apart from that, it's not always about looking younger. It's actually about looking in proportion. So somebody has a nice face but a big nose. So if you have a male nose on a female face, obviously that's a very big misfit. So beauty is all about proportions. So if you look at any object in the world, you appreciate objects which are proportionate. If you look at a building called Antilla in Mumbai, obviously you would not appreciate the proportions of it. But if you look at Akshardham, if you look at Taj Mahal, you know that it's such a proportionate figure. So it's always about proportions, and in the human body as well. If you look at the Leonardo da Vinci's pictures that he has drawn about the human body proportions, you know that it's all about proportions always. The face has proportions. We have different kinds of what we call divine proportions. But overall, it's all about consciousness of appearance. If somebody is conscious of their appearance, and as a plastic surgeon, if I can see that there is an abnormal proportion there, then I think the two things meet and I may decide to operate.
Somebody's really spent a fortune in creating that disproportionate building somewhere which you talked about.
Sorry, no offense, man. It was just that, things which are aesthetic. It was more about aesthetic.
It's an interesting example which you gave.
Yeah, I hope the owner of the building is not listening to me.
No, there's someone.
He might choose to go to another plastic surgeon instead.
So Vasundhara, this mirror thing that Sunil talked about, mirror is always a liar. Either it makes you look better than what you are, or makes you look worse than what you are. So how to objectively look at yourself? And especially when a patient comes to you saying that, okay, fine, I'm not happy with this appearance. Do you provide the person with some perspective that how to assess themselves, that whether their appearance is actually okay or not okay?
So when a patient comes to us and they have usually done some homework, or they, as Rashmi and Dr. Sunil have been saying, patient has been thinking about it, or they are growing up with it, and they have it could be a childhood deformity, as he's saying, and as Dr. Sunil says, it could be an aging process. So all these things are always playing on the mind of the patient. So number one, they have to have the guts or the willingness to come to show to somebody and discuss it out. And once they do see it in the mirror every day, as you say, and when it does, number one is when they get aware that there is a solution for it. So that is when they try to look out and search out somebody who will help them resolve that thing which they don't like. It may be something congenital, it could be something acquired, age, trauma, burn. We have a whole gamut of this. So we have plastic and aesthetic surgeons who are trying to restore this thing back. So definitely a mirror does help them. And as he said, there is a mental image and a physical image. So our job is to try and help them restore it. So we should not deny that it doesn't exist. And as far as the science, how far we have advanced, we should be able to help them out of it. And as Dr. Sunil says, it has to be realistic. Realistic in the sense that we should also be able to deliver it to some extent, maybe not completely. So there, that's where we play. And then the same thing of proportion, symmetry, what are they thinking? We should give them time to express it, and then give them all the options possible.
Correct. So patient comes to you with some expectations, and you assess whether the expectations are realistic or not, whether they are deliverable or not. No. Rashmi, how do you manage those expectations of a patient? I think that is probably the most crucial part that you have to deal with to begin with for a patient.
So I think just sort of talking in the same vein which Dr. Sunil and Dr. Vasundhara have mentioned, I think when a patient comes to you, say if I take for example somebody comes for a rhinoplasty or what is called a nose job, and they say, I want a nose like this. Can you make my nose look like maybe some celebrity? There are sometimes red flags because you can improve somebody's own nose. You can't try to deliver them something which may not match with the rest of their features. Secondly, as you get more experience and as you are talking to patients, you want to be sure that their goals are realistic, their expectations are realistic. They're not looking to change their appearance to such an extent, which of course you can't deliver, and it may not look aesthetically appropriate for their face or and not be in proportion to the rest of their appearance. So that is important. And I think also what is important is to basically understand their motivation for doing it. The motivation should be, I'm happy with myself, I'm content with my appearance, but I want to enhance it or improve it. It shouldn't be that I'm going to do this and then it'll allow me to become a model. That's not the case. I mean, you can do all sorts of surgeries, but you may not make it big as a model or an actor. If I do this, my significant other will like me better, or I'm doing it to so all those motivations have to be looked at before you plan or before you tell a patient that yes, they are a candidate for a procedure. So somebody who's sort of content with themselves but want to enhance their appearance, it's not a means to an end. It's basically to make you feel and look better, but it can't give you the surgery can't open doors for you or give you wealth or give you position.
Vasundhara, how often are those results which a person expects, they actually get it? Do they get it more than 90% of the time, or is it a different figure?
I would say it is differently figured for different procedures, because we are going to be molding as a plastic surgeon the available tissues with the patient. So within that realm, if we can fit it in, yes, some people are very happy, some people are dissatisfied, because there is a limit to the surgery. Beyond a certain time, all the risk factors starts coming in and all the complications can start. So there comes an ethical limit to surgery. So that is where we would say it's not always 100% result. There is always something which may not be. Sometimes we know it, sometimes the patient knows it. So it's a two-way process. Even that is why counseling the patient beforehand is very important. They must understand what is going to happen, and maybe show them images, show them some results, so they start accepting the new state they will be in.
Sunil, we're not talking about the appearance, and when we talk appearance, it is the face which comes to the mind and to the eyes as the very first thing. So what all can be done to enhance the appearance of the face? What all do you do as a plastic surgeon to improve the appearance of face?
Well, that's a $1 million question. If you really look at the face as an organ, if you really think about the eyes, the function of the eyes to see, the function of the ear is to hear, the function of the nose is to breathe, the function of the mouth is to eat. So the question is, what is the function of the whole face? Well, the function of the whole face is appearance. So appearance is extremely important because that is your first door to the world, because everybody sees you. That's your identity. That's the reason why your iPhone has a, face recognition software. So the proportions of our face, in spite, rather than talking about the functionality, the appearance itself is so important to us as a human being, that any disproportion in the face would actually be very disheartening to a lot of people. The most common abnormalities that one sees in youngsters, basically as far as face is concerned, is to do with the nose. Because any nose abnormality, which is the center of the face, attracts attention. I always say to the patient that if somebody doesn't talk about your nose to you, then that means you have a nice nose. If somebody's actually talking to you, but the eyes don't meet your eyes and the eyes are focused on your nose, that means that you really have a problem with the nose. So when I do a rhinoplasty and the patient comes back and says, nobody's complimented me for my nose, I say that's a good thing. That just means that you have a normal nose, because nobody should be complimenting you for a nose.
That makes me happy. For years, nobody has talked about my nose. That's great. Nobody's called me Pinocchio also. No? So.
Yeah. So I think nose is a very common, surgery. So anybody who has a disproportionate nose, it can be a short nose, it can be a long nose, it can be a humpy nose, it can be a crooked nose. So it comes in all types of varieties. Just like mangoes, a nose also comes in lots of different varieties. And I think as plastic surgeons, we do a great job at rhinoplasty, which is one of the most complex aesthetic surgery that we do. And it's always a surgery of, it's a surgery of millimeters, because a few millimeters here and there can make a lot of difference. And it's always a surgery of the third and the fourth dimension. The fourth dimension in the rhinoplasty is about breathing. The 3 dimensions are the physical aspects that you see. But I always say that the surgery of rhinoplasty or the nose is basically a 4-dimensional surgery. And as a plastic surgeon, we not only look after the physical appearance, but we also try and improve the functionality of the nose and whenever we do a rhinoplasty as well. So breathing can become better as well, because of the deviated septum can be corrected at the same time. But I think it's a very satisfying surgery, most of the people. But one has to have red flags for some of the patients. And, I hate to say, but male rhinoplasties, the patients are not always extremely happy about it, because whatever you do to the male nose, which has a thicker skin and a different kind of texture and elasticity, doesn't always give you the best results. Female rhinoplasty, because of the pliability of the tissues, thin skin, and probably the mental disposition as well, they always seem to appreciate this much better. Luckily, 80% of our patients are actually female, patients, and that's the reason why the satisfaction rate is pretty high. But we need to be careful about the male patients when we think that they don't have too much of a disproportion, because a heavy nose looks okay on a male face. A little bit of a hump looks okay on a male face. I mean, look at Shah Rukh Khan and Tom Cruise. I mean, they have noses which have big humps, but they are superstars. So, but that type of a nose would never look good on a female nose. I mean, that's just the way we are, I'm not trying to put any bias on this. It is just the way we actually look at things. But I think overall in the face, nose is a central part. As we age, obviously, you can have eyelids which become heavy with baggy eyes. You may actually like to do some blepharoplasty, which is eyelid surgery. I mean, you're an ophthalmic surgeon, so you probably see some of these patients and refer as well. The lines, the dynamic wrinkles and lines we get at an early age, like 40 plus, they may respond very well to non-surgical methods like Botox, fillers to actually plump up the lines like the ones that we have around the nose, the laughter lines. And there are so many other things that you can improve, like the forehead. You can do a brow lift if the eyebrows are sagging down. You could even lift the angles of the mouth by just doing a little Botox in the lower part of the angles and one of the muscles which depresses. So, fundamentally, every part of the face, appearance-wise, can be modified, whether it is the eyelids, whether it is the forehead, eyebrows, nose, lips. You can do augmentation of the lips. You can, as Rashmi alluded before, little kids, they can have prominent ears. Those can be kind of, made to look normal as well. One of the good things about plastic surgery, and here I wanted to wish all the, people who have joined us, all the friends, happy Plastic Surgery Day. It's a global plastic surgery day. It was yesterday.
Oh, yes.
And,
yeah.
Basically, I'd like to wish everyone here as well, Rashmi and Vasundhara as well. I think it's a great thing to have as a because the National Plastic Surgery Day month has been recognized as a Global Plastic Surgery Day. So it will help us create more awareness about the work we do, because majority of people think we just do nips and tucks. But plastic surgery is one of the most wide tertiary specialty, very, very interesting work. And I think we are one of the most complex and creative surgeons as far as the surgical specialties go. And
But the
the
objective
good
of
thing
today's
is,
show is exactly that.
yeah, and the good thing is that we do all ages. So we can talk about a 3-month-old cleft lip and palate or a craniosynostosis, which is a skull deformity that I would do on one day. And the other day, I would probably be operating on a 80 plus year old with an oral cancer and reconstructing the mouth. So your patients can range from a newborn patient to a centurion. So that's kind of the beauty of the work that we do. And also everything that is visible is our domain. So head to toe. And one of these things, basically is also responsible for the fact that people don't understand what plastic surgeons actually do. Sometimes plastic surgeons also confuse everyone by, calling themselves as either aesthetic, plastic, reconstructive. It's kind of, a mix and match kind of a bag. So sometimes it's very difficult to know what is a plastic surgeon, what is an aesthetic surgeon, what is a reconstructive surgeon, what is a plastic surgeon. So I think it's basically a combination of all, and people probably according to their experience and their likings, a lot of surgeons would pick up one part of the specialty and excel in that. So some of us would probably excel more in aesthetics, some would excel more in reconstructive job, and I think that's the beauty of the specialty, that it just I mean, it's basically sky is the limit for your creativity when it comes to plastic surgery, because there are at least 3 different ways to do everything that we do, and there can be more.
Great, that's interesting. Very, very interesting. Vasundhara, we get to hear that a lot of film stars, they get their face lift done or a face plastic surgery done, and they come out younger and brighter and more beautiful. How much is that as a reality, and can all of us think of something like that, or is it only a myth that we hear about?
No, it is not a myth. And I think there was a question in between that is it vanity to get a plastic
Yes.
surgery or
Yeah.
aesthetic procedure done?
Yeah.
Somebody, definitely not. It is not vanity. It is the need of the hour. It is the need when everybody is going to work. People are not just indoors, and you are moving in a community. And our stars are like our role models. And earlier it was considered an unaffordable surgery. People used to go abroad for getting them done. Now it is available, and our own doctors are trained for it. So definitely they are the inspiration also to other people that yes, you can improve your looks. And mostly it is an aging process which can be improved upon, and there is a lot of ways to do it, as Dr. Sunil has mentioned, from non-surgical to surgical, the facelift and the brow and the eyelids and the cheeks. And now the trend is shifting towards the jawlines. So people are becoming more aware of the early signs of aging. And yes, most of our actors, people in the media, they do get some procedures done, and it is helping the subject also. And yes, they do look very beautiful. We have lots of actors who are in beyond their 70s, and they pass off for say 50s or 45, and I think they're doing a great job. And they are reflecting that it is an encouraging subject, and
Great.
people must come forward to get it
it
done.
gives me a new hope now for future.
Yeah.
But we often see, Rashmi, that sometimes when the actors they get some face job done, and the outcomes are not really as pleasant as one would really want. And are you able to reverse those things? Is the reversal also possible after a surgery has been done?
Um, it really depends on the type of surgery that's been performed, and you're right. There are times where people get multiple procedures done, and it sort of alters the face to the point where it may not be recognizable or it may not be aesthetically pleasing. Which is something that I think both Dr. Vasundhara and Dr. Sunil Choudhary have alluded to, in that you when you are seeing a patient or you're counseling somebody to do a procedure, you really have to make sure that they have realistic goals, and also that they are not going down, the rabbit hole, if you will, of plastic surgery, where they're just doing one procedure after another procedure, chasing after something which is probably not achievable. And it, as a good and a ethical plastic surgeon, it's your job to be able to guide the patient as to what procedure will work and what will not work, and where should they draw the line. And as surgeons, you draw the line oftentimes and you say, look, I will not do this because I don't think it's the right procedure for you. um, some things are, of course, reversible. So, you do fillers and or you do Botox, they will reverse. There are some procedures that you can reverse. Maybe if you've done, fat injections, or, the nose has been overdone, you can correct them to a large extent. But there are certain procedures which, of course, you can't really reverse. And so the most important thing is really at the time of counseling, that you're counseling them that these are not, that, don't, this may not be appropriate for you at this time, or it would not, it would alter your appearance where it would not be aesthetically pleasing. And really, when you're doing, say, for anti-aging, you're actually making somebody look good for their age. It's not like you can make somebody look younger, or you can make them, even when you look at your own photographs from when you were younger and when you are older, gravity takes its toll on everybody. Whether you are, doing everything, if you were doing a headstand all the time, yes, gravity won't have that effect on you. But other than that, nobody can overcome gravity, and everybody wants to look good for their age. So, the question that was raised, that is this vanity? It's not always vanity. It's also just looking good for the age. Now, as work is more corporatized, everybody wants to have a longer work life. If you're going to look old and tired, maybe, you won't get the next job, or you won't rise further because you just look old and tired. So those are realistic things. And then, when you talk about the younger patients, like the kid with the prominent ears who's being teased about prominent ears, it's not vanity to fix it. You take young boys who have a little bit of the breast enlargement, like gynecomastia. It's not vanity. He's going to be picked on in the locker room. And, they're going to feel embarrassed in the gym. They won't go and play sports or go swimming because other kids will tease them. So these are actual real issues which interfere with their, with life, or with getting on with life. And so it's not always vanity, it's also required when you're looking at, because these procedures are considered aesthetic. Pinning back a ear or removing the male breast is considered a cosmetic procedure, but it's not a cosmetic procedure for the person who is being picked at, or who's embarrassed by it, who can't lead a normal life. So those are the kind of things which, though in our country people will say, "ये तो cosmetic hai, this is what's the problem? It's not harming your life. What's the need to do it?" But that's not true. If it's harming you psychologically, if it's interfering with your quality of life, then it's almost like a necessity, and it's actually a need rather than a desire to do it. Anti-aging also, same thing. It's not necessarily vanity. I think we all want to look good for our age, and we all want to have a long work life, and be able to hold our own in among our younger peers. So all these are sort of part of, they can be considered a part of, life. It's not necessarily that you're doing it only because you're vain about your appearance.
You mentioned about the male breast of gynecomastia, but even the female breast is a very, very important part of the image or persona of a woman. And there also at times, the shape or the size is such that may affect the psyche of the person. What do you do for them?
So often, I mean, in our country, most often, I would say, as a female plastic surgeon, I see women for reduction rather than an augmentation. If you look at the Western countries, or you look at, statistics from country like the US, their augmentation is a far more common procedure than it is in, say, a country like ours. When there is a heavy-breasted woman, it's actually a physical as well as a psychological trauma, because The woman would have upper back pain, postural changes, neck pain, shoulder grooving, intertrigo, which is basically having skin rashes because of the heavy size of the breast. So a reduction surgery is usually what is advised, and it makes a huge difference to the woman's everyday life, her ability to exercise, her ability to wear appropriate clothes, not to be embarrassed about the size of her breasts, or it be the focus of people's attention. Like Sunil said, if somebody is noticing, not commenting on your nose, then it means that your nose is fine. And a lot of women who are heavy breasted would say, the focus is always on their breasts, so they're embarrassed by it. So certainly reduction is a very good option, and it gives them both physical as well as psychological relief. Even with asymmetry, or if they're small breasted, there are options. You can do breast augmentation with implants. We also do take your own fat and do fat injections in the breast to augment the size of the breast. So certainly there are many options depending on what is the issue. And male breast, like we talked about, it is it's an actual physical, psychological issue for young men or men who face the problem. And it's really not a very complicated or a long procedure which enables us to correct that for them so that they can again have a normal life.
Talking about breast surgery, Vasundhara, these days breast carcinoma has become very, very common, and at times, in advanced cases, the breast has to be removed, and thereafter it leaves behind a big scar. So, what sort of reconstructive surgery is possible nowadays in plastic surgery?
It's a very good question, and it is very important that this topic is taken up as an individual topic also, because there is a lot of reconstruction to be done, to be advised at the same time when they are being diagnosed for the cancer. And we have new techniques of cancer surgery, from small to large surgeries, and small removal to large removals. So all of them should be advised at the time that yes, it can be replaced by their own tissues. At the same time, they can leave the theater with a breast in place. So we can make it from the back of from their back or from their belly, or we can put implants, we can put expanders. It has to be advised. It is exactly in the same position as a bariatric surgeon patient being told that his hanging skin will be tucked in. So we have to increase the number of people to be aware of a reconstruction. They will not only get the volume back, they will also get a nipple areola reconstructed. It will make an immense difference to their confidence, their ability to wear clothes, their ability to go to the gym, exercise, and again lead a normal life without being scarred and thinking about it for the rest of their life. So this is a very, very important thing, reconstruction. It can be done. Yes.
Sunil, Vasundhara referred to bariatric surgery, and Rashmi talked about breast reduction, but you do a lot of liposuction and you deal with bariatric part also. So how does a plastic surgeon help people take care of their whole body shape as such, like abdomen, thighs, hips, back?
So there is a class of patients who lose a lot of body weight. It could be because of their own efforts, or it could be because of bariatric surgery, which is obviously a weight reduction surgery. When you lose a lot of weight very quickly, then often the skin doesn't really shrink that well, and you have sagging skin all over the body. The most common area where patients are really worried about and bothered about is basically the abdomen, where they have a huge pendulum of remaining skin and a little bit of fat as well, which is resistant fat. And this really causes a lot of difficulty in walking, wearing clothes, often causes a little bit of rash underneath the pendulum as well. So it becomes a real impediment in their daily life. So post-bariatric body contouring, which could be a simple abdominoplasty where you just trim the interior, the front part of the abdominal skin and create a new belly button, could be one of the simplest things. Or you could be in some patients where there's a huge amount of 360-degree laxity of skin, maybe even doing a 360-degree body lift, where you not only lift and tighten the abdomen, the pubic area, but also do a lift of the buttocks as well and the thighs as well. So these can be quite life-changing procedures for post-bariatric patients, because having lost the weight in the first 1 to 2 years time, and many of them lose anything between 30 to 40 kgs of weight, maybe 3 to 4 years goes away very quickly once they realize that they don't look good. In spite of the fact that they've lost so much of weight and they thought that they're actually going to look quite nice, they're actually left with all this horrendous deformities where the pendulum is hanging, and in some patients almost till their knees. So post-bariatric body contouring is a very, very important closing of the loop for these patients. And if you look at these patients, they may have other areas as well, like the breast, where the breast may be very saggy. So they may require a breast lift. Some of them lose a lot of volume in the breast, so I would combine a breast lift with a implant surgery to create more volume. Or you could even do fat grafting in these patients to a certain extent. They have arms which are hanging like bat wings. They may require an arm lift. They may have thighs which are hanging down and also rubbing against each other when they're actually walking. So that may require a thigh lift as well. So there's a range and host of body contouring procedures, and they may actually require a facelift as well, because if you really look at a lot of patients who lose weight, the first place from there where they lose the weight is the face. So a lot of people who do a lot of training, marathon running, athletic procedures, they're very fit, but often people look at them and say, "Are you're looking very weak," and the reason is because they've lost the facial fat. So these patients can often benefit as well. I've actually had a doctor who came to me from Punjab who had actually, started gymming and built a lot of muscle, lost a little weight, no body fat, and his face was looking almost as if he's aged 10 years. So we did a fat grafting for the entire face, and this guy is so happy. He's a practicing doctor, so obviously face is quite important to him. But I think plastic surgery is not just vanity, as we all talked about. It's a little bit of vanity as well, because obviously we all want to look good. If we didn't want to look good, we wouldn't wear, good clothes. We wouldn't actually, wear all the kind of, nice accessories and try and wear nice spectacle frames, or even, put on whatever gear you want to put on. So I think it's in human nature to look good, feel good about it, and we want to be appreciated as well. So I think there's nothing wrong in that, as long as it is safe, as long as it is not being done for unrealistic expectations. I think it's a perfectly legible and a justified cause.
Sunil, bariatric versus liposuction. What are your views on that? When would you say liposuction works?
So I get a lot of patients who are morbidly obese. They come to me and they want to have liposuction as a means of weight reduction. I always tell them that liposuction is a lifestyle surgery. It has nothing to do with weight reduction. Even if I remove 5 liters of fat, it would probably have, the translation, if you look at weight reduction, would be just about 2.5 kgs, not more than that. I mean, if you really think about a simple corollary, if you put butter on water, it always floats. So fat is actually quite light. It's just the volume that actually makes it look big. But overall, weight-wise, fat is actually lighter than fluid. So patients who want to have a massive weight loss, like 15 kgs, 20 kgs, you just can't offer them liposuction, because if you were to remove so much of fat in one go, one would actually have a huge amount of complications like blood loss and electrolyte imbalance. So one would not usually remove more than 5-6 liters of fat in majority of patients. It can vary from indication to indication, but overall large volume liposuctions have to be done extremely carefully in very selected patients. Most of the patients would not have a weight loss because of liposuction. So it's more about spot reduction, that you've actually got a reasonable, good proportionate body, but say your flanks are out of proportion, or your double chin is out of proportion, or your arms are a little fatty, then those are the spot areas where surgery can do wonders, because if you lose weight, you may lose weight in areas that you don't want to lose weight, and you may not lose weight from areas that you wanted to lose weight from, because you can't target weight reduction with weight loss that you do. But surgery is targeted. So that's the best advantage of surgery. And I think in patients who really are not looking for weight reduction, but just a little bit of body contouring, liposuction is great. Otherwise, I always send these patients, refer these patients to the bariatric surgeon. Morbidly obese patients have no business or being, with us for doing weight reduction surgery like liposuction is not a weight reduction surgery. So I think appropriate referral of these patients is very important.
Rashmi, another area where the plastic surgeons play a huge role is that in cases of scars and burns. And burns can actually leave a person really devastated, for life. Can disfigure any part of the body or the entire body. And how do you manage those cases?
So burn care itself is one of the, it's almost like a critical care specialty. There are a lot of depending on the percentage of burns, like how what percentage of the body is burned. Patients may require very intensive care and specialized care, especially if they're anything above 20-25% of the total body surface area that is burned. In the acute phase, of course, it's management of the wounds and then doing skin grafting. Oftentimes, we would see patients subsequent to their acute burn and recovery from that because of the scars. And then, of course, tightening of the scars causing deformities where there is fixed contractures, what you call contractures, basically meaning that they can't either extend their fingers, bend their elbows, straighten their elbows, or the neck is stuck because of the burns on the neck or the chest area. So again, it really depends on the degree of involvement or the complexity of the post-burn sequelae that they have. There are many different modalities that are being used. From releasing the contractures, you may sometimes have to do flaps, which means taking skin with the fat and the underlying fascia and reconstructing that area, or it may just be with skin grafts. And sometimes you try and expand the skin, which is normal, with expanders, which are like basically balloons placed underneath the skin, so that you can expand the like skin or the similar skin and use that in the reconstruction. But it like Sunil had mentioned earlier, there are different parts of plastic surgery and different specializations within plastic surgery. So somebody may be trained in just doing taking care of hands. Somebody is specialized in just doing reconstructive microsurgery. There are a lot of plastic surgeons who are specializing just in aesthetic surgery. Similarly, in plastic surgery, burns is actually almost a discipline in itself, because the burn patient, especially in the acute burn, require actually a multidisciplinary care. They require critical care. They require, intensive management of the burn wounds, their nutrition, their surgical interventions, which can go on for a fair bit of time. And again, it really depends on what is the extent of the burn. Um, but yes, in our country, we do see a lot of burns, also, because of either accidents or household accidents, or, you know, um, hot water, or even household fires. And again, depending on how extensive it is, you can either manage it as an outpatient, or sometimes you do have to admit and, do the various surgical interventions. And once they've healed, it's settled down, then you do other interventions to improve the scars.
Besides all the things that you mentioned, there is also like there we have those acid burn victims also, and who really have it really bad. So I would like to use this opportunity to convey a message to the masses that it's very easy to burn somebody by throwing an acid on their face or on their body, but it's almost impossible to reverse the effect of that. So and never ever think of committing anything like that in your life. Don't harm anybody like that. A question has come up in the chat that can aesthetic surgery also help in gaining weight and making our a targeted body increase thing? So can weight gain be possible by plastic surgery? Sunil?
Weight gain is not possible by plastic surgery, but what you can do is you can shift fat from a place to another place. So if you think that you have a lot of fat, say in your belly or the flanks, and you don't like it, but you want to put that fat into the breast and get breast augmentation, that's a very good possibility. And a lot of my patients who actually come for liposuction of the abdomen, I often offer them complementary breast augmentation at the same time by using the fat that we're going to discard. So I think it's about shifting the fat from places where it looks abnormal to places where it may look beautiful. So I think that is possible, but unfortunately, you cannot add weight by actually doing that because you're only using patient's own fat. So you can only shift them. You can't actually add, you can't really make them weight gain because of this.
Another procedure which has become very common nowadays is the hair transplant, and I think it's being done by plastic surgeons as well as the dermatologists. What do you suggest? What are your views on hair transplant? Whether it should be done, not be done? How successful is it? Who should go for it?
So, hair transplant is a procedure essentially for people who are mostly male pattern baldness or losing hair very fast because of the genetic composition and their hormonal profiles. Obviously, it can buy you a few years by transplanting some hair from the back of your head, which is the occipital lock of hair, which are the most hardy hair because they don't. Even if you look at people who are bald, you'll always find that there's some hair at the back of their head. So these are the hair which can be transplanted to the front. It is surprising and sometimes it amuses me how little can actually make people happy. So a few thousand hair can actually make, so men can really be happy with very few things. That's all that I can say. So, but overall, if you really think about it, the cause is not gone. So people keep losing more hair at the back of the head, and it is possible that they may left with last few men standing at the front and a few back. But it's all about timing. So it's the most kind of that kind of a social age group that people really want to mingle and they don't want to look bald because of the obvious look factor. And I think it may actually help youngsters to tide over sometimes people who really want to face the world and they don't want to look bald because of so I think it may help many people to actually tide over, but eventually, yes, it works for a small period of time. The few hair that you transplant, they may remain, but most people will keep losing the rest of the hair. So I think it's a good procedure for selected people who understand what kind of expectations they should have from a procedure like this. And there have been recent advances in hair transplant as well, where you can actually pick up single hair follicle and transplant, which actually has good results. Personally, I don't do many hair transplants because I think a lot of people have taken hair transplant as a sole kind of procedure now within the plastic surgery and dermatology and other specialties as well. So I think it makes much more sense for people to do hair transplant who do nothing but hair transplant because the laborious procedures and people do, a lot of people would do just hair transplants. But I think there are lots of plastic surgeons who enjoy doing hair transplants and they would probably do as part of their practice as well. But I used to do hair transplants initially, but I found that it was just too, time consuming and there's too much of, other work to be done in an institution. So we've actually, kind of, stopped doing hair transplants in our institution. But overall, I think it's a good procedure for, people who really want it.
Yeah.
Vasundhara, another procedure which is emerging nowadays is the cosmetic gynecology or reconstruction or aesthetic surgery for involving the private parts, especially in females. So, what all is possible there? What all is required there, and what are the indications for that?
Cosmetic gynecology has really come up very well, not only with the plastic, but the gynecologist as well venturing into this field. And it is a very important subject because now we are understanding that aging is not related only to the face or the breast or our arms or our feet, our hands. It is also affecting it is always affected, but people are becoming aware of it, is about the perineal rejuvenation, as we call it. And it has many, many parts in this subject, and each part can have its own aging process or also have some congenital anomalies. So with people, some it could be due to a professional requirement, it could be due to their some people are getting married again, some people have had many children and now they want to enjoy their life again. So it should not become a taboo for them or a deterrent to lead a normal life. So in this, there are many, many procedures. Some I can narrate some, like it's called labiaplasty. There is something called vaginoplasty. There is vaginal rejuvenation. There is also strengthening of the pelvic muscles. There is restoration of volume. Like we are describing, fat is used for rejuvenating the face and the breast. Fat can also be used for some people who have loss of volume of the perineal region. So it also gives them a youthful appearance. People do go to the beach, or they want to have a normal sexual life. That is where the plastic surgeon or the aesthetic surgeon comes in the picture, and they help you restore these structures back. And this is a very rewarding, and patients are very happy, and people are now coming to us and asking us for these procedures. So it's a good procedure, and you can always explain it to the patient, and they're quite aware about it, and they want them done now.
Sunil, is there anything equivalent in the males for the males also?
So I think in males, there's mostly about lengthening of the organ or enhancement of the organ. Most of the procedures basically are to do with a little bit of fat grafting or maybe a little bit of liposuction around the pubic area to lengthen the area. But that's pretty much it, because the other realm of the functionality would go into the urologist domain in most of the cases. We would not do too many procedures in that area overall. I think it's more of female aesthetic plastic surgery which is coming up, and there's more demand for it. I see a lot of young girls as well who have large labia, and they are actually having problems with sports like horse riding and biking because that interferes with that. And we do a lot of labiaplasty for that. Uh, People who lose weight also again may benefit from fat injections into the labia majora, and that might actually rejuvenate those areas as well. People who lose weight, massive weight loss, can have a lot of sagging in the pubic area, and that interferes a lot with that area as well. So when we're doing an abdominoplasty or a body lift, we do a two-way lift. So we actually bring the curtain of the abdomen down. At the same time, we actually lift the pubic area up as well. And that seems to increase, that really seems to rejuvenate their intimate life as well. So I think overall, there's a reasonable demand, growing demand for female, aesthetic genital surgery. And I think there's a good trend and healthy trend about it as well.
Rashmi, we all talked about how the surgery can help us, but sometimes things don't always go right. There can be problems also, there can be complications too. So what all things can go wrong, and then how do you guys deal with it, and how should a patient deal with that situation of, say, any kind of plastic surgery?
So depending on the type of plastic surgery, there can be complications which are particular to that procedure. So if you take, for example, liposuction, which again Sunil touched upon when he talked about it, is that there can be electrolyte imbalances. You can lose a lot of blood, especially if you're doing a large volume liposuction. There are certain risk factors which are associated with things like a tummy tuck or abdominoplasty or liposuction, which is deep vein thrombosis or pulmonary embolism. I think the most important thing is recognizing that these are the possible complications. So it's at the experience of the surgeon who's counseling the patient and who's taking the history of the patient to be aware of these, these risk factors, and also explaining that to the patient. And then, of course, patient selection, so that you're not trying to do a massive volume liposuction on a outpatient basis on somebody who's say obese or moderately obese, because those are sort of red flags and the risk of complications are higher. So preventing the complication, understanding that these are the possible pitfalls and complications, is really the most important thing in reducing the risks, rather than trying to undo it after the fact. Um, they are, and of course, if somebody does have, say, a deep vein thrombosis or a pulmonary embolism, then you would treat them appropriately, like you would a pulmonary embolism from any other cause. And of course, that then means that they need to be hospitalized, they may need to be on blood thinners, they may need to be monitored in an intensive care. So these are all things that you have to then watch out for. I think the biggest and the most important thing is reasonable expectations from the patient, reasonable goals from the patient being informed about the risks and benefits of the procedure. And that is, of course, the job of the plastic surgeon or the surgeon who is evaluating the patient for a procedure, to be able to provide them the risks and benefits, and of course, an informed consent. And by informed consent, it doesn't mean that the surgeon has written down these are the possible complications and listed a laundry list. But actually having explained that to the patient, that these are the kind of risks that we can encounter, and what are your chances of these risks, and how do we prevent them, and experience of the surgeon, being ethical about your work, explaining, taking time to counsel the patients, it goes a long way towards preventing these complications, and then of course subsequently managing them, suppose if they arise. I mean, infections, bleeding, blood clot, or like a hematoma, these are very commonplace, which you can get in any kind of routine surgery. And so all these, you will have people on antibiotics, you will put them on devices during surgery to reduce the risk of complications, uh, so that they are minimized basically.
Why is plastic surgery so expensive, Dr. Sunil? A tricky question. No? Why is it so expensive? No?
I think it's a lifestyle surgery in many cases. Plastic surgery is not always expensive. I think it is just the way we look at it. I think these are, just because it's a cosmetic surgery doesn't mean that it's actually a surgery which is very easy to do. It's not that it's a simple surgery. Most of the plastic surgery procedures that we do are pretty complex. And just because some of the procedures, like the cosmetic surgery procedures, are not to do with life and death, so a lot of people think that they should not be very expensive. But that isn't, it's not like that. It's all about the skill involved in doing what you do. And I think patients who really want to do a lifestyle surgery, they should be willing to invest in it as well. We do a lot of reconstructive procedures as well, which are obviously, much, much more complex and intensive as well. And I think the cost is just commensurate to the kind of work that you do. I don't think plastic surgery is more expensive than anything else.
But the problem is that the health insurance does not pay for these procedures mostly.
Yeah, so I mean, health insurance doesn't pay for it. That's true. But I think if you can invest in actually buying a good iPhone, if you can invest in buying a good car, if you can invest in buying that piece of jewelry that you want, I think why not invest in yourself? Because at the end of the day, it's not a damage; it's an investment in yourself. Whatever you do with plastic surgery to look good, it's going to stay with you for many, many years. Even if you look at a facelift, the average life of a facelift is almost 8 to 10 years. So I have patients where I've done endoscopic facelifts. They have come back after 8 to 10 years and they look quite good. I've repeated some of the procedures after 8, 9 years as well. And I think overall the amount of contribution it can make to actually making them more happy and increasing their quality of life, I think it's worth it. And I think everybody should realize. And at the end of the day, you can always save for it.
Yeah, that's a very, very important thought. Rather than looking at it as an expense, once you look at it as an investment into your own personal self, into your persona, into your personality, into your future also. So I'm coming towards the end of my show. So I'll take the final message for the public. Vasundhara, what is your final message to the audience with regards to plastic surgery?
That do not be shy. Do come up to your doctor, ask your questions, and we want to have a very beautiful society around us.
Great, fantastic. Sunil, what is your final message to everyone?
I think I would like people to understand that plastic surgery is not just about facelifts and nips and tucks. Plastic surgery is a very beautiful and creative specialty which deals with a lot of complex problems as well. I think we would like to be called the healers amongst the surgeons and the doctors, because we do a lot of healing for patients, whether it's wounds, whether it's cancer surgery or trauma surgery. I mean, people are amazed that they think that plastic surgeons don't do anything apart from skin surgery. In fact, I've had relatives who come to show me skin problems that I would myself refer it to the dermatologist. They really think that we are just glorified dermatologists sometimes as well. So there's a lack of awareness about what we do. So I think it's it's a heartfelt thanks to you that you've organized something like this, where we are creating awareness about the kind of work we do. I think it will benefit all of us, because there's so much of work which is there. So it's not just about one of us. It's about creating more awareness about the specialty. The more awareness the specialty gets, the more work we all get as well, and more people actually benefit from the skill that we have. And I think that's the message I want to give, that plastic surgery is a really huge amount of creativity, and it can bring a lot of difference to your life. And many surgeries that we do are basically, they can be life-saving, they can be life-altering, and in most cases, the quality of life always becomes better, because if you feel good, you always have a good life.
That's a wonderful message, but I was expecting a very poetic answer from you. And for the sake of the audience, for the benefit of the audience, Dr. Sunil Choudhary writes very good poetry, and in Hindi. So I was expecting him to give a poetic message rather than. But anyway, that's a wonderful message for everyone.
You caught me off guard. I didn't prepare one for this one, but next time.
Sure.
Yeah, this is a
Rashmi,
great show. I would love to be back on your show. Yeah.
You'll be invited back again soon. Rashmi, what is your final message for everyone?
I think, people like Sunil said and Vasundhara said, people should consider that plastic surgery is all about repairing, restoring, and also recreating, what is lost or what is missing or what has been removed because of, some kind of ablative surgery. And, plastic comes from a Greek word, which is plastikos, which basically means to mold. It is our job. And what we do is to mold the different parts of the body to repair and restore, and to complete somebody who's lost a part of their body or or being born without a part of it. And it's not just skin deep, it's a very complex, three-dimensional, and again, taking Sunil's word, it's a four-dimensional thing, because it's not just restoring form and function, but it's also restoring somebody's self-esteem and their psychological well-being.
Great. So I'd like to thank all of you very much for coming onto the show and for sharing wonderful wisdom with all of us. Final message from me to everyone is that the possibilities in plastic surgery are unlimited. If ever you feel that there is something in your appearance, in your body, which is affecting you, or hurting you, which you want to change, do not feel shy. Do not hesitate in reaching out to a plastic surgeon, discussing, evaluating, taking their opinion. And if they also concur with you, then you can actually go ahead with and maybe got some changes. I think Dr. Sunil was raising your hand, saying something. Yes, please go ahead.
I think you wanted me to end with a poetic note, so I thought of one.
Why?
I think Hindi में कहें तो I mean it's all about, जैसे बहुत सारे लोग हमारे पास में चेहरे के दाग लेके आते हैं और हम उसके लिए कुछ प्लास्टिक सर्जरी करते हैं, कभी लेजर करते हैं. तो ऐसे ही एक पेशेंट की शादी हुई, तो उसके बाद उसके पति ने उसके लिए कहा कि ओ फलक के चांद, हमने भी चांद देखे हैं, तुम में दाग है, हमने बेदाग देखे हैं.
Wow, fantastic. Great. So you have actually removed the craters and the blemishes from the moon itself. So that's what is the gist of the Hindi poem that Dr. Sunil recited. So thank you once again, all of you, for coming onto the show. And I'll like to thank my audience. And I'll see you again next week, same time, on yet another session of Dr. Dhawan's Live Chat. Till then, bye-bye. Namaste.
Bye-bye. Thank you.
Bye-bye.
Bye.
I welcome all of you to IBMTV and to this show, which is Dr. Dhawan's Live Chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The Live Chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste.